Welcome back to the show Talk with Your Doc. With me is Dr. Harshad Telang, and we are talking about colorectal cancer. We just talked about various risk factors, what are the tests done to early diagnose the colorectal cancer, and once the biopsy of colorectal cancer comes as positive, then only I come know that I have a cancer. But before doing the biopsy, before doing the colonoscopy, what are my signs and symptoms which tell me that I might have something abnormality in my body?
So unfortunately, most colorectal cancer patients don't know that they have cancer, and that's the problem. Is that a lot of patients will show up when it's beyond the truly curable stage, and then we will need to talk about other modalities for treatment. But the most common sign that patients will complain of is bleeding.
Bleeding per rectum.
Blood mixed in with the bowel movements.
Right.
And then change in bowel habits can also occur as the tumor gets larger and starts causing more problems with passing stool. Those would be the two most common symptoms.
So after age of certain 50 years, say, and if I get low hemoglobin or I find blood in my stool, I should be concerned and
Yes.
approach to the doctor, not ignore that symptom probably.
Yes, absolutely. If your family doctor does blood work and finds that your blood count is lower than anticipated,
Right,
and there's no good reason for it,
right.
then that would be an indication to be not concerned, but be checked out.
Yes, yes. So once I go to the doctor will do my colonoscopy and they will send it to us for the biopsy. And in the biopsy, we may say it is adenocarcinoma or different types of colorectal cancers like carcinoid tumor or GIST tumor or lymphomas. Most common is adenocarcinoma. That's what we see in our practice. What are my chances of survival?
So the chances of survival depend on a few factors, whether the cancer is limited to the bowel, whether there's any spread of the cancer either locally, whether it's spread beyond and to other organs such as the liver or the lungs. So it would depend on those factors. So if it's limited just to the bowel, if it's been completely removed, then chances of long-term survival are very high.
So once I am diagnosed with the disease on the biopsy, for my survival chances to be determined, you might do some scanning procedures like CT scan or PET scan, or what else you do?
So once the diagnosis of colon cancer is made, patients will almost routinely get a CT scan of the abdomen, just to determine if there's any spread of the disease, and to also look at the primary cancer to determine whether any other treatments are needed before surgery.
Okay.
And then after the operation, they will be followed by the cancer clinic. They will receive they'll be put through other tests, possibly CTs of other areas of the body, depending on the concern for metastatic disease. And they'll also need routine colonoscopies for follow-up to make sure that there aren't any new primaries or the primary cancer hasn't come back.
Nowadays, we see a lot of patients being treated with neoadjuvant chemotherapy even before they are being treated with surgery. And this neoadjuvant chemotherapy will reduce the bulk of the tumor and make the tumor size small, and then we remove by the surgery. So what are the surgical options available for the patients with colorectal cancer?
So with we basically divide it into two parts. So there's the colon and then there's the rectum.
Yes.
Exactly.
Yes.
The colon is, and there are two totally separate disease entities from a surgical point of view.
Right.
Because the colon has the fatty tissue around it, and the rectum doesn't. And so for the colon, even if it's a large tumor, as long as there isn't any evidence of it spreading beyond the cancer itself, even if there's lymph nodes involved, we will proceed to surgery. Whereas with the rectum, if there's lymph nodes involved, if there's any chance of local spread of the cancer, because the pelvis is such a confined space and the risk of not taking it all out is higher, they will undergo neoadjuvant treatments, so radiation or chemotherapy before surgery.
Before surgery, right. So for colon cancer and rectum cancer, there are different surgeries, and the patients also are in the different stages. So what are the surgical options available for the colon cancer surgery?
So for colon cancer, basically it's a colectomy.
Colectomy.
And we label it by based on where it is. So if it's in the right side, we call it a right hemicolectomy. If it's on the left side, left hemicolectomy. If it's in the sigmoid, then a sigmoid colectomy. So, but the goal is to take out the cancer, but 10 centimeters or so of normal colon on either side, or 5 at the smallest amount, and to take out the lymph nodes that drain it, because cancer usually spreads through lymph nodes, and so we want to get a minimum of 12 lymph nodes in our specimen to give us an idea of the completeness of the resection and the chance of spread.
So patients are usually apprehensive, what will be my lifestyle after my segment of colon is removed, you know. Like say somebody's half of the colon is removed in the surgery, then they have a pouch and they have apprehension about the pouch procedure also. Can you please explain us about the lifestyle changes or morbidity associated with the colectomy?
Sure. So when we're dealing with just the colon part, if we take out any part of the colon, like we discussed, there's really not much of a change. They may have more frequent bowel movements, but there's really no other major impact long term in terms of their bowel
Even though
habits.
they have a bag attached?
Yeah, so the bag is a different issue. So that is usually only when we have to do rectal cancer surgery. And so if the cancer is very low, down near the anal sphincter muscles, and we can't take out the cancer without the risk of leaving some behind, then we have to take out the sphincters and everything, and then you'll end up with a permanent bag.
Permanent bag, yes.
Other times when we do a low cancer operation and we do the joining, and we might give a bag just temporarily, just to protect where we did the joining part. So
and the life comes back to the normal after the bag is removed?
If it's a temporary bag, we can put it back together.
Yes.
Yes. If it's a permanent bag, then it's there for life.
There for life.
And as you said, most patients are very apprehensive about it, but once it's there, everybody adapts. I haven't had a patient yet who has regretted having to have that operation because it was medically necessary.
Because the life is saved.
Yes.
Now there are other options of radiation and chemotherapy also. So which patients do get radiation after the surgery?
So radiation is limited to basically the area where they can put the beam. So for rectal cancer surgery, it's used much more frequently. Any other type of colon cancer, it's not used very frequently unless there's cancer that has penetrated into the muscle or something of that they can focus the beam on to hit the cells. Chemotherapy is systemic, and so chemotherapy will be used for most rectal cancers and for colon cancers where there's lymph node involvement, or if there's any spread of cancer to liver or lungs.
Metastatic disease, probably, right? And how do you stage this? There is a staging system called TNM staging system. Can you please tell us how do you stage the cancer? Like what stage am I in a disease? So what do you do?
So the staging system is based on 3 factors. One is the tumor, which is the T, so the size of the tumor plus the penetration through the various levels of the colon wall or the rectal wall. N is the nodal status, so whether the lymph nodes are positive, and then depending on number plus location. And M is the metastatic, so it's either negative or positive, if there's 0 or 1.
So my treatment, if I have a colorectal cancer, will depend upon T, N, M, and M stage. What is the size of the tumor, what are the lymph node status, and how far it has spread.
Absolutely.
Which will determine whether I need surgery along with chemo or radiation, probably.
Correct, yes.
Thank you so much, Dr. Telang. This is very, very helpful, and I'm sure all the viewers will get benefit out of your time and expertise. We really appreciate it. Next time, we are going to talk about the lung cancer. So please join us with the next Talk with Your Doc for the lung cancer disease. Thank you.